The Gombe state government is rewriting the story of the Almajiri children by launching a set of campaigns towards taking them off the streets and providing a conducive learning environment for them. The latest efforts of the state government is the provision of access to good medical care through the Gombe State Healthcare Management Agency GoHealth, which has enrolled 1,000 Almajiri children.
Health, as you know, is something that can be transmitted, although not all diseases are transmittable. If we claim to be healthy, like I said, and the Almajiris who sometimes use their services in the house are not healthy, we can still contact them. At any rate, even if it's not Almajiris, if all of us are not well, then you are still not well, because the other person can transmit it. So we have decided to go down to the ladder, those that we believe cannot afford it. In fact, we were supposed to have started with them, because some of us can afford it. But since they cannot afford it, we are supposed to have started. But it's not late, and that is what we are continuing.
With new hospitals being built across local government areas, the State Commissioner for Health, Dr. Habu Dahiru, says the state government has transformed the health sector within a short period.
I truly feel excited that we're able to implement the vision and mission of His Excellency the Governor Muhammadu Inuaha. When he first came in, he made a promise that we are going to rehabilitate and take off this Almajiri off the street, establish formal school, provide them with numeracy and literacy, and then integrate it with provision of good nutrition and health care. Now today, with the introduction of GoHealth into their program, meaning registering them to have access to health facility and receive care.
For the Education Commissioner, Professor Aishatu Megari, the enrollment of Almajiri into the health insurance scheme justifies her ministry's efforts to take education to the next level.
This will go in a long way in our RTC model, the retention, transition and completion model of our schools, because a healthy child is a child that will be retained in school, will have the capacity to learn very well, and then with our mega schools, megas and girls schools, 3, one in each senatorial district, our bilingual schools, 3, one in each senatorial district, and our 11s and girls schools, 1 in each of the local government areas, and some even having 2 or more than 2 even. You see, when we enroll them, we put them back in school, already there's a health care provision for them, because when they are healthy, they will go to school.
Meanwhile, the executive secretary of the agency reveals more benefits of the health insurance scheme for vulnerable persons in Gombe State.
Today marks another milestone in our journey towards the attainment of universal health coverage in Gombe State. I'm glad to report that His Excellency, Governor Muhammadu Inuaha, has released the state counterpart for the Basic Healthcare Provision Fund for the year 2024, and has equally directed the release of the Equity Fund, for the Equity program in Gombe State. And he specifically directed that we should identify all key vulnerable populations in our communities and ensure that we reach out to them and enroll them into this Equity program. Today, we have started with the Almajiri children, and inshallah, in the coming weeks, we are going to the orphanages, and then we'll reach out to other key, vulnerable populations in the nooks and crannies of Gombe State.
The Gombe State government is confident that this healthcare initiative will improve the well-being of residents and promote healthier communities.